Okay, our last topic, resources and some action items for you. As you digest all this information, some to-do items that hopefully the financial aid office has already helped you with at orientation. Another reminder, lean on the financial aid office for help and talk to your colleagues as well. But guys, get the details on the loan programs from the aid office. Talk to your colleagues about budgeting. Talk to them about their careers. Talk to them about the relationship of their debt to what they're planning to do. And hopefully you'll see that it's not adversely impacting those decisions at all. Pay attention to your borrowing, and guys, just plan to run estimated repayment each year. I showed you one simple slide with some repayment numbers on there. There are enough calculators out there that this should not be difficult. Once a year, go in, look at your borrowing, get an idea about what your repayment's going to be. And what this does is, guys, is when you go to your senior loan exit interview, whether it's done in an individual session or a group session or a large group or however it's done, even online, you're not surprised by anything. You don't have that deer in the headlights look because you know what's coming. Keep your loan servicers in the loop. I've mentioned that before. You can find them on NSLDS. Be sure they know what your current address is at your dental school there. Budget wisely and borrow responsibly, and educate yourself. That's what this is all about. And think like a D4. Prepare yourself for graduating from dental school. And also talk with your family about support if they've mentioned, excuse me, if they've talked to you about possibly supporting you financially some way. We talked about how they might be able to pay the interest for you on some of your student loans. Now, in terms of resources for you, I've already referenced the NSLDS site. That's the comprehensive listing of your federal Title IV loans, and that, guys, is your Stafford, your Grad Plus, any Perkins loans you may have in federal consolidation loans. GoDental.org, some great information on dental school and financial aid, and we're going to have updates and articles for you. Hopefully you've been to that site, you've bookmarked it, and you know it well. Use that to your advantage. The direct loans that you borrow, and again, that's going to be all the Stafford and Grad Plus and dental school. The website for the direct loan servicer is myedaccount.com, and you may already have that site set up. You have to set up a profile or log in and set up passwords and stuff. But that's where you can track and manage your direct loans online. Those of you who are thinking about, whether it's now or in the next few years, and you're thinking about possibly doing additional study, perhaps in a residency program, and you're concerned as you start running these numbers every year that I just mentioned to you about, you're concerned about how much the payments are going to be, and you think, well, maybe I need to look at a program that lets me pay as a percentage of my income. The IBRinfo.org calculator is a great place to get some estimates of what your payments would be under the income-based repayment plan. Again, talk with your aid office about that. If you're interested in the Public Service Loan Forgiveness Program, the Department of Education has recently updated that site. There's some great information there at studentaid.ed.gov/public service. So we've covered a lot. Hopefully you've watched this, all the components of the presentation, but whether you have or not, we talked about the cost, we talked about your student loan portfolio. Hopefully you've got a little bit of an idea about the changes in financial aid and how they may impact you, and some items to keep on the radar screen. We talked briefly about student loans and credit and wound this up with some resources and some action items. So the takeaway, others have pulled this off and they've set the gauntlet down for you. You certainly can be successful in financing your dental education, and we're delighted that you joined us for this presentation. Thank you for that. Good luck in dental school and good luck in your dental careers.